All right. So first off, I just kind of wanted you to give me a general description of the organization and what you guys kind of do and help people in the area.
Sure. New Beginnings is the only agency in the state that's sole purpose is to work with runaway and homeless youth. We operate 3 core programs. We have the only 24-hour emergency shelter for youth in the state. We have a street outreach program that does physical outreach to the community as well as has a drop-in center attached to it. And we have several transitional living programs where young people get their own apartment and build the skills to live independently. We also have available to any youth who's in our programs an educational support program that helps young people either build on the educational capacity that they have or re-engage them with education if they've been disengaged from education for a while. That program also helps young people with employment training and vocational work, helps young people apply for college, those kind of things.
Yeah,
We
awesome.
have a mental health program that any young person in our agency can work with. We've found over the years that when youth are on the streets or struggling in their lives, it's very hard for them to meet the expectations of some of the larger mental health providers in the community. And so we meet young people where they are. We will sit on a bench with them in the park and have a session, or go to their apartment, or pick them up and bring them to one of our counseling offices.
Yeah,
And that way, it's a much higher likelihood that young people will engage in mental health services. We have a prevention training and education program where we work statewide providing HIV prevention training to other agencies, state agencies, schools, other community nonprofits as well. And we do that free of charge to anyone, as well as we're doing right now motivational interviewing training for people. So it's an opportunity for us to share our skill set across the community. And help build the capacity of other agencies. We have one training that's called Creating Safe Spaces for LGBTQ Youth, because not all agencies really have the skill set they need to make young people feel welcome regardless of their gender identity or sexual orientation.
yeah,
So that's the kind of the core of what we do. We're primarily based here in Lewiston, but we also have services in Augusta and Farmington as well.
yeah, awesome. And do you guys, so, reading through your website and just all the things that you guys have put out there, do you guys majority, like, do you guys often just more serve LGBTQ youth rather than other homeless youth, or is there kind of a mix?
There's kind of a mix, but the reality is LGBTQ youth experience homelessness at a much higher rate than their non-LGBTQ counterparts. And so in the community, in youth ages, 16 to 21, which is the range we primarily serve, youth that identify as LGBTQ at about 7% of the population. We see as much as 40% of the youth that we serve are LGBTQ. And that is predominantly because of family rejection when they come out, or when they express feelings that are, they're non-binary or whatever it is, they get kicked out of the house. And unfortunately, it's usually a violent experience for them. And so they're coming to us not only with the trauma of leaving home, but the trauma of rejection from the family and being abused in some way or another.
Yeah. Have you guys, I'm not quite sure, how long have you been with the organization?
I've been with New Beginnings for 4 years now.
4 years, yeah. Just speaking with your other coworkers, have you ever, with the influx of like the Somali population, was
Mm-hmm.
there ever an increase within the cases that you were dealing with, specifically like LGBTQ, or did it remain pretty stable?
I think it remained pretty stable. We still see a lower percentage of immigrant refugee youth here. I think that community is very insular and tries to manage all of its social challenges internally. But there are times when we have seen unaccompanied youth. They are here with no parent, no guardian, and we serve them at our shelter and our transitional living program. But it's not proportionate to the percentage of immigrant refugee youth that live in the Lewiston area.
Yeah, yeah, totally. So kind of speaking more on like the COVID-19 situation, I
Mm-hmm.
think we all kind of had that moment where we were kind of, we said to ourselves, this is very serious. For example, mine was, kind of jokingly, um, when kind of schools were shutting down, and I had some friends from other states, and they were like, oh yeah, our schools are shutting down for 2 weeks, and then it kind of hit me. And I kind of had a point where I was like, wow, this is like really serious. What was like your initial reaction to COVID, and like what was like your first decision and kind of
Our
tackling?
first decision was to send all non-essential staff home, right? And because we run programs that youth live at, that means most of our staff are essential. So,
Yeah.
and also any staff who are working in those programs who were determined to be by the CDC at high risk for serious complications of COVID, those staff also went home. We paid all of those staff. We never stopped paying anyone. And the staff who did stay, we paid them time and a half hazard pay for, I believe, the first 4 months. We were getting the PPP from the federal government that helped us cover that. So we were able to do that. All of the staff who we did send home, if they could work remotely, we set them up with remote work. And we also, those program staff who like didn't have jobs they could do from home because they work in programs, we tried to set them up with some opportunities to engage with the agency some way or another. Yeah. We also changed a lot of our program policies right away. We implemented, taking temperatures on a daily basis, doing symptom checks on a daily basis, sanitizing, mask wearing, all of those different things. And we immediately had, I think, 3 staff who showed up to work with a fever. And I'm like, nope, you gotta go home, right? You can't be here for 14 days. And that was a shock to people that we were that serious. Yeah. But we have probably tested 20 or so staff and youth over the course of this. Luckily, none have come back positive, but we take it very seriously. So we have set up a quarantine unit within our emergency shelter, a quarantine space within our transitional living program, and our drop-in center we closed for a period of time because we couldn't meet the CDC requirements for physical distancing within that program. We're just now starting to reopen our outreach program. What we did with our outreach program is we knew that young people were staying in unsafe environments because they didn't have safe places to stay. We knew that they were struggling with food insecurity. So we mobilized our outreach staff to do a mobile food pantry. So we would go out 3 times a week in a van full of boxes and bags of food and deliver them to where young people were staying. Not only did that help kind of resolve their food insecurity a little bit, but it also allowed us to have eyes on where the young people were staying and to have conversations about harm reduction and safety and all of the resources that do still exist during COVID. So because young people weren't coming to our drop-in center, and that's one of our primary points of contact with young people.
Yeah. So with like the drop-in center, and so you had mentioned like how your staff had to go home. I was wondering if any alumni or any people that had, connected with the program before had come back to kind of replace those who are more at risk rather than have them working. Were you able to connect with anyone?
No, but we anticipated that we would have a wave of resignations because of the level of risk it is working in this environment. I mean, we're working with homeless young people. And when you're in the programs, you can't be physically distant. You are at a dining room table, you're in a kitchen, you're in a bedroom, you're in a living room with a young person who may or may not wear a mask, because the young people, they're teenagers. They do exactly what you tell them to do all the time, right? We assumed that we would have a bunch of people resign because of safety conditions, and that didn't happen. So we were very lucky with that. I think having the hazard pay helped a little bit, but what we found is the people who were at higher risk for severe symptoms, they were itching to get back to work when we finally lifted that restriction.
Yeah. So you kind of mentioned the youth that you serve, and I was kind of wondering, do they understand the magnitude of the situation in the same way that you guys do? And
I don't think so. I mean, it has the feeling of like, I have a couple of teenage sons. One of them is like, I don't want to see anybody ever until there's a vaccine, and the other one's like, I want to go out and hang out with my friends, right? And he's got a car, so he goes out and hangs out with his friends. And so I think there's that whole spectrum of like being terrified of getting it and not wanting to spread it, and being mindful, and being like, this is really challenging for me. I don't necessarily believe it's that bad for everybody. And so we deal with that same normal spectrum. We're, youth who experience homelessness are just like all other youth. They are developmentally in a place where their decision-making is sometimes good and sometimes flawed. And it's many times as much based on logic as it is by hormonal decision-making, right? All of that comes into play.
Yeah.
Our job is to do harm reduction. If a young person is making what we believe to be really challenging decisions that put themselves or other people at risk, we inform them of those risks and give them strategies and tools to reduce the harm they do to themselves and others, right? And sometimes they take that information, sometimes they don't. Like several of the tests that we've had to do here are because young people didn't wear masks. They were sharing like cigarettes and other things, and not being socially distant, and going to a workplace that didn't have good policies, and people turned up sick around them, so we had to test them and isolate them. But we did the best we could.
Yeah. Did you find after educating them, whether through, providing, I'm not sure what you guys do as in, like if you were to provide programs, or like through one-on-one, were you able to educate them and kind of introduce them to more of the risks through one-on-one work?
Yeah, I mean, we do through the one-on-one work. All of the work we do is relationship-based, right? So the young people we work with often have been kicked out of school, kicked out of home, been in and out of custody of the Department of Health and Human Services. They've been arrested. They've got a probation officer, right? And they don't trust adults or systems. And we represent an adult-run system. So our whole job is to say, you can trust us. We're not going to respond to you the way that the police do, or that your parents do, or that your teachers do. We're going to listen to what you have to say and respect that. And once that happens, young people are much more likely to follow our guidance, but not always, so it's about building relationship and trust. Yeah. One thing we did early on too is, because we were so uninformed about COVID, just like everybody else, we put up on our website every week, it was just like a little bulletin of like, here's what we learned this week about how to be safe in COVID, right? There were things about social distancing and hand washing and sanitize. And so every week for, I think like 5 or 6 weeks, we had a post that was very youth friendly. It was graphic and it was easily downloadable onto a phone, that kind of a thing. So it was just informative. It wasn't preaching. It wasn't saying you have to do this. It's just like, this is what we know now.
Yeah. Yeah, totally. And that social media outreach is definitely important.
Yeah.
So I was looking, as I was researching you guys, I came across that, I'm not sure exactly when, I couldn't really find it, but you guys had a break-in and a vandalism occur, I think Yeah. So one of like your core goals is non-discrimination. How did the break-in kind of affect you guys, and how did you guys move forward with that?
Well, so I think it was a factor of the pandemic, right? The building that got damaged I was the only person working in it on weekdays, and on nights and weekends it was completely empty. And there were a ton of youth in the vicinity of the building who didn't have parental supervision. They no longer had the resources of like the programs that we run or the programs that other agencies run. And so they were in the community under the influence of other adults who were not helping them make good decisions. And so our building became like a target of opportunity, right? We had a ton of rocks thrown through windows, nobody actually ever broke in, but there were attempts to get in. And so, unfortunately, we boarded up our building for several weeks just to prevent the rocks from coming through while we had a security system installed. Once the security system was installed, we took down all the boards and we made them into sandwich boards that we had young people paint. And the idea actually came from young people who saw our building. They're like, oh, that's ugly. Can we paint those to make it look nice? And I was like, yeah, of course. But we didn't get it rolling fast enough So when the boards came down, we made these sandwich boards and gave them out to other providers and agencies in the community. We called them signs of hope. And so that was a really positive outcome from what could have been a very negative impact. I mean, it was hard to go through, but it was COVID, you know. I mean, there are businesses in cities with riots that have gone through much more than we did. And I think we responded to it in a way that was true to the agency's system.
Yeah. Have you guys thought about using kind of the sign of hope as a way to connect with the community in the future, like making more and kind of spreading them throughout the community?
Yeah, I mean, we have more of them that we could hand out because there were more boards than there were people who wanted to take them initially. So we could definitely put more out there. And it's, you know, it's on our website, and it's going to be in our annual letter and all of that, because it does feel like we took lemonades and made lemon, you know. Yeah. I mean, lemons and made lemonade the other way around.
Yeah. That's awesome. I loved hearing about that and kind of reading the messages that you guys wrote when I read the story that was ran.
Oh, thank you.
Yeah, it was awesome. So kind of looking at, you know, how, you know, obviously one of the big implications with COVID is economic wise.
Absolutely.
And with looking at like how other organizations have been affected by COVID, have you guys been hit drastically by that, or has it been?
Yeah, I mean, there were economic impacts. We definitely, so one of the pieces of the work that we do, it's called targeted case management. We work with young people to move them from a place of crisis to safe, stable housing with connections to caring adults, right? And we can bill main care to do that work, right? And so during COVID, we have not been able to do that with the youth we see in outreach. And so that income source has dropped off significantly. It was to the point for a while there where we were scared that we might not be able to continue that piece of the work that we do. But because of the PPP, and there were several foundations in Maine that made COVID donations to us. We had several $10,000 or $15,000 unexpected foundation grants that were unrestricted that we could use however we wanted. That helped us get over that hump, and now we're in a place where we're starting to do more of that case management work and being able to recoup some of that lost income. We also got a loan. There's a federal agency, it's under the Federal Health and Human Services Department, called Family Youth Services Bureau. And we get federal funding from them on a regular basis. They also had a COVID response thing. I think I can't remember the amount we got, but we got a significant amount of funding for that. And that funding was designed, like when I said we created a quarantine space in our programs, that funding helped pay for that. It helped us buy new freezers and new shelving so we could stockpile food, because there were food shortages and toiletry shortages. And so it allowed us to build up a reserve of those non-perishable things so that if we hit a second phase of COVID, we don't have to like freak out because we don't have any toilet paper or any toothbrushes for youth in our programs. Yeah. So there were impacts, but they were kind of offset by the generosity of foundations and some federal funding as well.
Yeah, that's awesome to hear, because I know there were a lot of places that, you know, didn't experience the same thing. So it's great to hear that a lot of people care about, you know, your mission and, you know, what you guys do to succeed.
Yeah.
So I think one of the bigger things that's kind of in question, along with like, you know, this idea of 2020 being a crazy year. So obviously one of the bigger things was the Black Lives Matter movement. And I was wondering kind of what your involvement with that was and what proactive steps you took to support that.
So we have been responding to Black Lives Matter in a very specific way. So about 2 years ago, actually it was 3 years ago, it was the year after I started here, I was looking at the demographics of the population of youth that we serve. And just with LGBTQ youth, I said we see about 20 to 40% LGBTQ youth, and there's 7% of the youth in the general population are LGBTQ. They're overrepresented here. In Maine, about 1% of youth are youth of color, right? In the population of young people who seek services at New Beginnings, it's about 13%. right? So again, youth of color are overrepresented in the homeless population here in Maine and everywhere in the country. And so at that time, I began exploring what does racial equity look like in our work. It didn't have a lot of traction then because we had all kinds of other things going on, and it wasn't an urgent thing to kind of draw our whole agency around. As a result of the Black Lives Matter movement, many more people within the agency are invested in doing that racial equity work. And so we've hired 2 consultants, one who's out of New York, one who is a recent transplant here from New York, to do 3-month-long racial equity assessment of our agency and begin a training process and put together for us a long-term how to build racial equity into our programs. Because it's not a one and done thing. Like after this 3 months, we'll have learned a lot about what we do right and what we don't do right, but we'll still have a long way to go to become a fully equitable agency. And so the goal is to have these consultants get us into a place where we know enough about ourselves to do the work and move forward over the course of the next 1, 2, 3 years to become a more racially equitable agency. Because over the 40-year history of the agency, we have been very proactive, mindful about becoming an LGBTQ inclusive agency, but we haven't done the same effort for youth of color. And so really putting that same amount of effort and energy and mindfulness into that process is important. And that's what we're doing right now.
Yeah, absolutely. I think what you guys are doing is awesome in that respect. It's amazing. You know, I didn't think about, you know, the effects of the Black Lives Matter movement, or, you know, I didn't think about it the same way that I did now as I did, you know, 3 years ago. And so
I think that's changed a lot of us.
yeah, it really has. And I think that there's kind of like this idea that, you know, these other social movements don't matter as much because this one's more pressing. And I think you kind of brought that up within like Black Lives Matter and how it didn't really matter then now, but it's kind of impacting your way here. And I think that, you know, that can kind of happen with a lot of movements or just kind of like support for different organizations. And so, you know, within the past couple of years, there's been a lot more kind of support for more LGBTQ services. And I was wondering if like, how are ways in which that you stay, not saying that you're irrelevant, but how are ways that you stay relevant within like the communities? Kind of, how are you guys able to keep people interested in staying involved within your organization?
Yeah, I mean, so we have a marketing strategy and a fundraising strategy that includes talking about who we are and what we do in a pretty honest and transparent way, so that, like, for the Lewiston Pride March, we've been the lead sponsor for years, right? And so it's important for us to let the community know who we are, what we do, and why we do it. Just like I'm telling you about the inequities of the way that LGBTQ youth come into homelessness. It's unconscionable, and that's important for us to identify and work to resolve. And so I think it's that level of honest communication that really matters for us. And it also draws people into our agency who want to work for us, who share those values and work towards that. So we have a very diverse workforce when it comes to LGBTQ peoples.
Yeah, totally. Yeah, well, that is pretty much all that I have.
Great. Those were good questions.
Yeah, I just wanted to thank you. You know, it was amazing to hear what you guys had to say. And I didn't really think about a lot of things in the same way, and it really urges me to kind of get involved. And I would love to get involved with you guys soon in the future too.
Sure. Yeah, absolutely.
Look into, I live less than 2 hours away, so I would love to.
We've had a long relationship with Bates and Bates students, so some very good experiences.
Yeah. Well, thank you very much for speaking with me.
Welcome.
All right.
Have a great afternoon. Good luck with your project.
Thank you.